Hi, I'm Jeannie Sims, a certified asthma educator for Breathe, Pennsylvania, and I want to welcome you to this webinar, Proper Breath Intake for Asthma Inhalers. As your certified asthma educator, when you connect, you will receive current asthma education, programs, and resources for your child with asthma. I'll also be able to support you in creating an asthma team that will include a school nurse and healthcare provider. You receive a student asthma kit that contains the tools you need to properly manage and control your child's asthma. Today, I'd like to discuss the in-check dial. As a certified asthma educator, this is a tool I find to be very helpful when I'm working with a child on how to properly use their asthma inhaler medication. The in-check dial is a handheld tool with a dial top which rotates, and this dial can be adjusted so it mimics the breath needed when using an asthma inhaler medication. It helps to identify whether a child is using their inhaler correctly and can be used to explain the different breath needed when more than one asthma inhaler device has been prescribed. I included this picture because it just helps us to appreciate just how many devices are out there today that house the medication used to treat asthma. And it can get very confusing on what is the correct breath intake to use when using any of these devices, and especially if you're using more than one inhaler. The in-check dial can help the doctor and child decide which inhaler works best and easy for the child to use, and that's going to help to improve compliance. The child will be able to see and feel how to adjust their breath intake to get the most medication they can into the lungs. As a certified asthma educator, I can work with the child and we can practice together on how to improve the self-administration of their inhaler medications. Next, I'd like to show you how the in-check dial works. The mouthpiece on this device rotates according to the inhaler that you want to practice. On the side, you see an acceptable green zone and an unacceptable red zone. Hit it against the palm of your hand, turn it upside down to set the red magnet inside, and you're ready. Find the inhaler you want to use. In this case, it's going to be a DPI Pulmicort. Find the correct icon flow. Rotate the mouthpiece to that icon so it matches the arrow on the side. You're going to insert a disposable mouthpiece, stand or sit straight, exhale, place it into your mouth with a tight seal of lips, and then inhale as you normally would on that inhaler. Let's see how he did. In the case of his DPI inhaler, he fell into the acceptable green range. Let's reset this device and try it again. This time, we're going to try an MDI. We find the correct flow range. Rotate the mouthpiece until it lines up with the arrow on the side. Insert the disposable mouthpiece, sit or stand straight, and exhale. Place it into your mouth with a tight seal and inhale as you normally would. Let's see how he did. The MDI tends to be the most difficult one to achieve proper technique. And as you can see, he did not fall into an acceptable range. This tool allows us to practice with a student until they get the correct intake breath for their device. Thank you for joining me today for this short webinar. I hope it encourages you to ask questions. If you would like additional educational video support on these topics, understanding asthma and allergies, understanding my child's asthma inhaler medications and devices, peak flow meters and exercise, keeping cool at school with asthma, just contact Breathe Pennsylvania and we can share a link with you. I hope you enjoyed today's short webinar and want you to know that as certified asthma educator, I'm available to you. So if you have questions or want to discuss your child's asthma, please feel free to call me or email me. Stay safe and stay well.